Today's Pilates Flow will help relieve any lower back pain you may be experiencing. It is extremely common due to new activities such as carrying your baby, late night feeds, which all increase the load through your lower back. All you need today is a mat and some space on the floor. For those of you who are new to my channel, hello, my name is Meg and I'm a physiotherapist. Remember, it's always important that you have medical clearance before beginning an exercise program postpartum. And if you feel any of the 3 Ps, pain, pressure, or P, make sure you stop the exercises and book in with your healthcare provider. So making your way to the back of the mat, we're starting with some standing roll downs. So we're going to inhale as you grow tall, then exhale, we're going to nod the chin, melting the vertebra down one vertebra at a time, keeping the knees soft, and we want to keep the weight towards the ball of the feet. So we're going to inhale here, and then exhale, we're going to lift up and in through the pelvic floor as we start to restack the lower back, the ribs, the shoulders, the head. Inhale as we grow tall, and then exhale, peeling back down. Keeping the knees soft, letting the arms dangle down and the head relax. Breath in, and then exhale, lifting up and in through that pelvic floor, wrapping below the belly button. Slowly restacking that spine one vertebra at a time, the head being the last to come back up. Big breath in, and then exhale, peeling back down. So this should feel really nice through the spine. Big breath in at the bottom, and then exhale, slowly restacking one vertebra at a time. Last one here, we're going to breathe in and then exhale, keeping those knees soft. And then when you're at the bottom, we're just going to gently walk out to a downward dog position. So in this position, you can keep your knees bent if your hamstrings are feeling a little tight, or you can lower those heels down, whatever feels comfortable. The main thing here is that you want to maintain a neutral lower back. So I don't want to see a big dip. I want to make sure that the lower back is lengthened, that we're pressing the floor away. We take our gaze up towards the inner thighs, the head relaxes, and we just take that big breath into the bra strap line. And then exhale, just breathing out through the pelvic bowl. Feeling those sit bones widen. Big breath in. And then exhale. Melting the shoulder blades down the spine. Just moving into now, just pedaling those feet. Alternating side to side. Getting a nice stretch down through the back of the calf. Even weight still through both hands. One more either side, and then we'll just move into pedaling both feet at the same time. Three more here. Last one. And then just gently lowering those knees, making your way down onto all fours. So here we want the wrists directly under the shoulders, knees under hips. We're going to inhale as we take our gaze forward, open through the collarbones, lengthen through that tailbone. And then we're going to exhale as we start to curl the tailbone and press that floor away. So inhale, lengthen. Breath to movement here, and then exhale, start to curl the pelvis, rolling the spine and pushing the floor away. So it is really important here that you don't feel any pressure down through that pelvis as you press up and push the floor away. If you are, just really focus on the breath to movement and just reduce that pushing away. So just make the movement a little bit softer, and you'll find you won't get that pressure down through that pelvic bowl. This is really nice to get a full body or full spine mobility, as particularly through that thoracic spine, the upper back, which can get really, really tight due to poor posture. One more here. And then exhale. And we're just going to reach those arms long into puppy pose as we relax the forehead down, thinking about the sit bones widening, and also thinking about the releasing from the tailbone to the pubic bone through the front of the pelvis. So we're thinking of completely relaxing the entire pelvic floor. Inhale, breath into that bra strap line, and then exhale. You may even get a few clicks, a few cracks. And really just melting into this stretch. And then just gently coming back onto all fours. We're going into pelvic rock backs now. So we're going to take the right leg out to the side. Find that nice neutral spine so we're not curling through the lower back. We're not arching. Beautiful length through the tailbone. And we're going to exhale as we press away as far as we can, maintaining that neutral spine. Inhale, coming back to center. Exhale. Inhale. So it's really nice to get a bit of lengthening through the inner thigh and also stretching through the right side of that pelvic floor. And we're still nice and active through the arms, that we're not collapsing through the chest. Well done. Pressing that floor away. And one more here. Gently coming back to center and changing sides. So left leg out, finding that nice neutral spine length through the tailbone. Exhale, press away as we lift up and in through the pelvic floor, wrapping below the belly button. And then coming back up as we take that breath in. So exhale. You may find that you're tighter on one side. This is definitely my tighter side. Again, nice and active through the arms, long through the neck. So we're not collapsing that chin forward. One more. Coming back in, we're going to go out knees wider than hips and then gently going into a rest pose. So really nice here to take that breath into the belly and then exhale, not forcing that breath out, just a nice gentle breath out. Inhaling through the nose and then exhaling out. So you may find that you're tight through those hips. So if you feel that they feel like they're just a bit sticky and they're not letting go, focus that breath into the front of the hips. And every time you exhale, you just think of the hip bones sinking into the hip socket. Two more breaths here. We're going to gently thread the right arm under the left. Let the head relax down onto the floor. Going into thread the needle. So you may feel more of a stretch between that right shoulder blade. So we're not forcing this stretch. It's just a nice pressing down of the right palm into the floor. And focusing that breath into that right shoulder blade. Two more breaths here. And then gently unraveling back to center. And then threading that left arm. So looking under the right armpit, gently pressing the left back of palm into the floor. Breathing into that left shoulder blade. Two more breaths here. In through the nose, out through the mouth. Well done. Gently making your way back to center. And then coming up, we're going to make your way down onto your back. So from here, we just think about the feet, in line with the sit bones. We're going to reach the arms long, take a breath in, and then as we exhale, we're just going to roll that tailbone back as we peel up into a bridge. Inhale at the top, and then exhale, we're going to melt down. We're going to release the neck, the collarbones, the shoulder blades, the ribs, the belly button, the lower back, and then the tailbone. Inhale as we rock out, and then exhale, lifting up through that pelvic floor. Zippering up from the pubic bone to the rib cage. Inhale at the top, and then exhale, melting down one vertebra at a time. Enjoy that nice stretch through the spine. Breath in as we rock out, and then exhale. Inhale at the top, and then exhale. Really nice to really focus on releasing the neck, the collarbones, and the shoulders as they get really tight with feeding your little one. Inhale and then exhale, and they tend to want to do more work when they are not needed. So it's nice just to release the neck, the collarbones, the shoulders, the ribs, the belly button, the lower back, and the tailbone. Two more at your own pace. Well done. Breath in at the top, and then melting back down. Last one. Well done. Just bringing your arms down into a nice goalpost position. If that feels too strong a stretch, you can absolutely just place your arms by your side. We're going into some windshield wipers. So it is important here that we use the breath and connect with that pelvic floor and your transverse abdominis first, so we don't arch into the lower back and we just control the core. So we're going to breathe in as we prepare. And then as we exhale, we're going to check in, lift up through the pelvic floor, wrap below the belly button. Now we are engaged. We're going to inhale, and then exhale. We're going to float the legs to the left. Take that breath in, and then exhale. Use that breath to bring the hips back rather than focusing on the knees, bringing your body back to center. So again, we're going to exhale as we float the legs to the right, trying to keep the rib cage connected to the mat. Inhale as we hold here. And then exhale, really think of that wrapping below the belly button, floating the legs back to center, and then alternating side to side. So go at your own pace if you like. Just make sure you hold there for that inhale breath, and then exhale. It's the core doing the work and your pelvic floor to bring you back to center, not your knees. So I like to visualize that the knees are floating, or the legs are floating through oil. Well done. Exhale. Nice stretch through those obliques as they get very tight in pregnancy. This has to be one of my favorite stretches of all time, I think. Just nice to get in and stretch the core. So we're going to do two more to either side. Hold there for that inhale breath. Last one. Really try and focus on keeping the rib cage connected to the floor. Last one here. Well done. Just making your way now into sitting. So we're gently going to extend that right foot. Sit bones anchored to the floor. We're going to bring the right arm to the left knee as we reach up and over through the left side body, directing that breath into the left side and just breathing into the stretch. So we're not collapsing down, we're staying long through the lower back. Every time we take that exhale breath, we just feel that we reach a little bit more to the corner of the room. And then very gently, we're going to take the left rib cage towards the hip, still reaching, and you'll just find that that moves more towards the lower back. And again, just focusing that breath still into the left side body, but your gaze will now be down. One more breath here. And then slowly unraveling back to center. We'll take your right foot and place it over your left, making sure that your sit bones are connected to the floor. And we're just going into a seated version of your glute stretch. So some people may find that that is enough. Others will gently reach forward. So again, we're not going to collapse down through the spine. We want to think about pivoting forward off the hips. And we're just creeping a little bit further forward every time we breathe out. Well done. This is a really nice stretch, getting into the deep rotators of the hip. And then exhale, we just creepy crawl forward. And if you found that you have reached your limit, then we just stop there and we'll just hold that breath. Two more breaths here. Last one. Slowly unraveling. So we'll take that left leg out to the side, active through the feet, so drawing your feet up towards you. Left arm to right knee, and we're just going to reach straight up and over to the corner of the room. Every exhale breath, we just reach that tiny bit further, focusing the breath into the right side body, melting the shoulders down the spine. And then from here, we're just going to draw those right ribs down to the left hip as we gently rotate forward. And again, we're still reaching to the corner of the room, but the gaze is now looking down. And the stretch just moves more towards that lower back. Last breath here. Slowly raveling so you're nice and tall. Take that right leg over the top of the left. Sit bones anchored to the floor. Big breath in, and then as we exhale, we're pivoting forward off the hips as we creepy crawl forward. So another breath in, and it's the exhale breath that just melts you into that stretch. You may feel a difference side to side. So just going to where's comfortable. If you can't get as far on this side, that's absolutely fine. Just stop there and then take the couple of breaths where you're just focusing on melting into that stretch. Still focusing on melting the shoulders down the spine so you're not gripping through the neck or the upper back. Last breath here. Slowly pressing back up, unraveling, going into a butterfly stretch. So we're going to connect your heels and your feet. So by all means, you can bring them in closer to intensify the stretch, or you can go out further, whatever is comfortable for you. Just relaxing the knees towards the floor. If you feel that that's too strong, you can place some pillows under your knees just to take some load off the stretch. You can stay up tall through the stretch, or you can come forward and relax through that spine. So again, whatever's comfortable for you. I feel more comfortable sitting up nice and tall, finding length through my spine. So focusing that breath into the pelvic bowl, feel the sit bones widen and release. And then exhale, we're just feeling that gentle lift up and in through the pelvic floor as we connect below the belly button. Relaxing the shoulders long through the crown of the head. Enjoying this last stretch before we get on with our day. One more breath. And well done.